Hello, I'm Brian Law, and we're looking at carbon dioxide instead of iodine, a safer alternative to iodinated contrast. Carbon dioxide is a chemical compound. It's made of one carbon atom and two oxygen atoms. It's colorless and odorless gas at a standard temperature and pressure. In its solid form, it's dry ice, and it appears white and flaky. It's soluble in water, forming carbonic acid. So when physicians need to look at blood vessels using x-rays or CAT scans, they typically inject a special dye called iodinated contrast media to make the vessels show up clearly on images. However, some patients can't safely receive the iodine-based contrast because it might damage their kidneys or cause allergic reactions. For these high-risk patients, carbon dioxide gas offers an alternative option. This is a summary examining the safety and effectiveness of using carbon dioxide as a contrast agent in vascular procedures. Carbon dioxide is recommended for patients with allergies to iodinated contrast, also those that may be in the late stages or have chronic kidney disease, and those on dialysis. The need for these alternatives would be: one, the patient has an allergy or they have low kidney function. And carbon dioxide gas offers an alternative for these high-risk patients. Carbon dioxide can create negative contrast with less risk than iodine and travels quicker through the patient's body. This is specifically in angiography. The gas would be injected into the blood vessels to provide a negative contrast. It would appear visually dark on the x-ray. The benefits would be that it's lower cost and readily available. It's hypoallergenic. There's rapid elimination via the lungs, lower risk of gas emboli, so it dissolves faster than other gases. The carbon dioxide has some side effects. It can trigger muscle spasms in the blood vessels, and that discomfort can be enough to cause the patient to move and blur the imaging. There can be temporary pain at the injection site, abdominal cramping, nausea, feeling of gas pressure, and all that can be attributed to this carbon dioxide invoking muscle spasms. The side effects are rarer with carbon dioxide, and they occur less than 1% in the procedures, and it can be prevented through following proper safety protocols. The side effects could be that the air in the room mixed with carbon dioxide can create dangerous air bubbles or embolisms. Excessive gas can block blood flow and risk organ damage. And carbon dioxide can cause damage to the brain and spinal cord tissue if it reaches these areas. There's a lower than 1% likelihood of this occurring, especially when following the proper procedures. Safety measures would be proper administration and monitoring would help lower the risk of using carbon dioxide for contrast. So never inject the carbon dioxide above the diaphragm. Avoid face down or head elevated positions during abdominal injections. Allow 2 to 5 minutes between injections. And follow a proper dosage along with monitoring the patient with a pulse ox, blood pressure, and echocardiogram, and carbon dioxide and pressure monitors located in the room. So patients dealing with certain risks such as PAD, peripheral artery disease, or EVARs would be endovascular aortic aneurysm repair. The carbon dioxide should be the default option for contrast studies, as PAD patients' kidney injury rates using carbon dioxide range from 4 to 8% versus iodine would be higher, almost double, 11 to 15%. And in patients with EVAR, carbon dioxide cuts the iodinated contrast use by 50% or more. There's limitations to the carbon dioxide. It isn't ideal for every situation. It's not as detailed as the iodinated contrast. The limitations are as lower image resolution, difficult to visualize in small vessels below the knee especially. The faster flow through vessels requires special imaging and needs to be very quick. Motion artifacts from the patient moving, and we had discussed earlier the side effect could be the muscle spasms, which may cause the patient to move. Using carbon dioxide as a default for most cases where iodine isn't needed would benefit the industry from both a risk and a resource perspective. So in conclusion, some questions could be answered. Why would a physician choose to use carbon dioxide gas for imaging instead of standard iodine dye? That would be carbon dioxide is a safer alternative than iodine. What is the single most important safety rule for preventing serious complications with carbon dioxide injections? And that would be the need to use proper safety protocols and monitoring to mitigate risk. What is a common but minor side effect that patients might experience during the carbon dioxide injection? And that would be slight discomfort at the injection site. What is the main proven benefit of using carbon dioxide for patients with peripheral artery disease? And it can reduce kidney injury and PAD procedures and cut down the use of iodine. What is a key limitation of carbon dioxide angiography that might make it unsuitable for some procedures? And that would be that it's suitable for imaging below the diaphragm, but above the knee specifically.